Hi, welcome back to Move365. If you're watching on Instagram, remember to click the bio and hit the link for the YouTube video where we will have the full-length video. We've been talking a lot about hip hinging, and I wanted to explain to you why it's so important. Besides activating the muscles in the glutes and the back and keeping you strong in those areas, one of the most important things to consider is what moving in a flexed pattern with your lower back, so not moving in that nice correct hip hinging way, what that does to the discs in your lower back. Now a disc, this is two vertebrae with two discs. This is the back, this is the front. We can see the spinal cord represented here, and these first branches of the spinal cord, the nerve roots coming out in between the vertebrae, just in behind the disc. Now a disc is a little kidney-shaped thing, a kidney-shaped cushion with a gel center and fibers that wrap round the outside of that gel, a bit like layers of an onion skin. And they go, those fibers, in different angles to one another to provide a stiffness and rigidity. But if we bend forwards from the waist, so bending like so, what happens to this central gel is a bit like the ice cream in an ice cream wafer. If you bite the ice cream wafer at the front, the ice cream scoots out the back. When we bend that way, this central gel pushes back onto the back wall of the disc. And if it does that with enough force, or it does it with sufficient repetition, what happens is it begins to break down the fibers at the back of the disc. They delaminate, they start to come apart, and they can become torn and damaged. And we start to get a disc that becomes misshapen. And in the worst situation, you can end up with a complete breach of the wall of that disc, and the central gel that should be contained within starts to bulge out, and you get these bulges or prolapses of the intervertebral disc. The outside 1/3 of the disc is pain sensitive, and so putting little nicks and tears into that tissue hurts. That's usually that first stab of pain that you get when you bend forward in the wrong way and damage those fibers. What then happens is that the surrounding muscles go into spasm and put some protective scaffolding around the injury site, and it becomes very difficult for you to move. It becomes very difficult for you to bend forward from the waist, that's for sure. And often people end up being forced into much better patterns of movement, hinging through their hips and their knees and keeping their back in that nice neutral position, just in order to go about their most basic daily tasks. So that's why it's important to use a hip hinge, because it's protective of those discs in your lower back. By keeping your lower back in a subtle hollow shape, even slightly exaggerating that as you go down into that hip hinged position, that squat position, it loads the disc in the optimum way, pushes this central nucleus, if anything, subtly forwards, and avoids that increased pressure back onto the back wall of the disc where the damage gets done. I hope that explains it. I hope that's clear. Any questions, comments, please put them in below. Please subscribe to the YouTube channel. Click the little thumbs up. Helps to share the information around a broader group of people. We're here every day bringing you better health through good movement.